In the last lecture, we talked about breathing patterns, that you want to find the ways that you breathe that help you relax. You need to share these with your partner. If you've already done a course, hypnobirthing, Lamaze, Bradley, any of the other skills-based courses, and you've learned some breathing techniques, compare those breathing patterns to what you learned in the last lecture. In other words, Birthing Better Families discovered the breathing patterns that each of them could use to relax themselves. And from the birth coach's viewpoint, which is your viewpoint, you had to hear right away whether a woman was using one of those good patterns or not. But if you don't share that knowledge, then you're not speaking the same language. And it's important that you speak the same skills-focused language with each other. So if you hear a woman who is moving from to at that moment, that sensation she feels or what's happening to her around her is causing her to begin to feel overwhelmed, and that flight, fright, and fight gets activated very quickly. So the sooner you can help her, the better. Now, how do you practice this when you can't practice? You just take a moment to do it. First of all, you imagine in your mind listening to your partner breathe. You do it anyway, but you don't know there's a purpose for it. So if you're driving to the hospital to have an elective cesarean, you know she's feeling tense. Just say, let's take a deep breath in together, and then let's just let it out together. So synchronize your breathing. And some couples do that when they are intimate together. It's one of those pleasurable things that some couples discover. If you're in labor and a woman's breathing fine, your job is to listen to that so that as soon as she begins to have difficulty, you take the deep breath with her. But you have to practice it beforehand. So the best time to practice it is to just say to her, look, I'd like to practice some breathing where you're having one of those tightenings, those Braxton Hicks contractions. So just ask her, tell us when it's happening. Let's take a moment. Let's just take a breath together and let's just let it out. Okay, then you can pretend. So let's say, you say to her, let's say it's more painful and you start to breathe like this. I'm going to hear that's okay. But if you start to breathe, I'm going to hear that you're feeling overwhelmed, and I'm going to then breathe. So please follow me. And she'll say, thank you. And when you get into labor, she will follow you. And you've done good. Well done, guys.